It's time again for Health Monitor, the #1 program that's shows you how to live a life in its healthiest way, to improve the quality of health and life and inspire you and give you the hope that you can live a healthy life every day. It's Health Monitor, yeah. Your guide to good health. It's Health Monitor, the #1 health show, yeah.
Welcome to your favorite health program, Health Monitor, your guide to good health. I am Ajenike Famujuro Fakayode. On the program today, we have the health tips segment, assisted conception and body care. Stay tuned, we'll be right back.
It's Health Monitor, the #1 health show.
Apples contain antioxidants called flavonoids, which may help lower the chances of developing diabetes and asthma. Apples are also natural mouth freshener and clean your teeth with each crunchy bite. Did you know an apple's flavor and aroma comes from the fragrance cells in apple skin? So for maximum flavor, do not peel your apple. Plus, the vitamins lie just beneath the skin.
It's Health Monitor, the #1 health show.
Since there are two tubes, if a woman has one of the tubes blocked, then there's a theoretical 50% chance in getting pregnant. We've had a 62-year-old woman got pregnant with twins and delivered.
Many women go from one hospital to the other, trying to cure what is not actually a disease.
Hello viewers, you're welcome to the assisted conception part of the show, and I'm Dr. Ivy. So today we are going to be talking about pre-implantation genetic diagnosis. This is an adjunct to assisted reproduction. When I talk about an adjunct, it goes hand in hand with IVF treatment. It's a method of profiling embryos before they are even transferred to the woman's womb. And this method can discern some factors in these embryos before even implantation takes place. PGD is a form of profiling these embryos, and we do a form of prenatal diagnosis, and it's usually used for searching for some certain kind of diseases in these embryos, even before the embryo is transferred to the woman's womb. That's before the baby is put back in the womb of the woman. So, having collected the eggs in IVF procedure, you collect the egg, you then mix it with the sperm, the baby starts growing in the laboratory. At that stage, we call it an embryo. This embryo, we then take a sample from the embryo and check for some certain characteristic. It's like a test of the embryo, just like the way you take a blood sample from someone to do a test. The same way we take a sample from the embryo and check for some certain characteristic. That is how pre-implantation genetic diagnosis is done. Usually, what is the advantage of this procedure? In our environment, the most important advantage here is that it's used for sex selection, genotype screening. It's also used for, there are some diseases that we call they are inherited X-linked disorders, which a mother can transfer to her son. The mother is a carrier of this disease, but she can transfer it to her son. She doesn't have any symptom, but her son can come down with the disease. Like the popular one is hemophilia. Now it can also be used for embryo quality, to know the good embryo before you go ahead and put back the babies in the woman's womb. Then another advantage, we use what we call HLA typing. This HLA typing is to match siblings. For instance, a sibling has a particular disease that will need a donor from her sibling. So you can use to match, okay, this sibling is going to match, like in leukemia, for instance, where you need a bone marrow transplant. You can use to do HLA typing for the next baby that is coming, so that the baby can be exactly match for the one who is sick. So in that case, when this child is born, the child can donate bone marrow to the sibling who is already sick. So those are the advantage of pre-implantation genetic diagnosis. But in our environment, the most important thing we use it for is sex selection and genotype screening. So with PGD, even if a couple is ASAS, it's no longer a problem. Before now, once a couple is ASAS, the only chance they get is to do what we call amniocentesis, in which the woman is already pregnant, then she goes to screen for the baby's genotype, and a sample of the amniotic fluid is taken and checked what kind of baby is she carrying. Is it going to be a sickle cell baby? And if it's a sickle cell, the pregnancy is terminated. That's what used to be in the past. But with pre-implantation genetic diagnosis, that's not the case. So even before the woman gets pregnant, what we usually do is to go ahead, check that baby. After we've done the IVF in the laboratory, we now check that embryo. Is this embryo carrying a sickle cell disease? Is this embryo carrying the sickle cell disease? We screen them. If she has like 5 embryos, we screen what's the genotype of all the 5 embryos. And then we replace only the ones that are free of sickle cell disease to the woman's womb. In this case, she's sure that she's not going to get any sickle cell baby. Then, as for when it comes to sex selection, because of this part of the world where we are, a lot of things are attributed to a particular sex. For balancing the family, you need sex selection. And because of the African culture, which I respect a lot of people want to have a male child. A lot of women out there who have been trying to have a male child. We have seen we have seen couples who have had up to 7 children because they are all the same sex. Probably they are all females. They want to crave to have a male child. With pre-implantation genetic diagnosis, this is the solution. What we're going to do is that once the embryos have been formed in the laboratory, we then check the genders of all the embryos and replace the desired sex back to the woman. So in this case, she's 100% sure that she's going to have the desired sex she wants. So if you want a male child or if you want a female child, you can do this with pre-implantation genetic diagnosis. So you see, for all the folks out there who have been trying to conceive or who have had female children or male children, irrespective of the desired sex you want, with pre-implantation genetic diagnosis, you can complete your family. You can balance your family with the gender you want. So you can see that the advantage of this is that it avoids selective pregnancy termination. A lot of people who are ASAS and they want to get married and they're like, okay, let's go and be checking. I know a couple who have terminated up to 5 times because anytime she checks, it's a sickle cell baby. Anytime she checks, it's a sickle cell baby. But now, with pre-implantation genetic diagnosis, you don't need to go through all that. You can have a sickle cell free baby. A sickle cell free baby without all the, and still marry and still be with your spouse. A lot of homes are broken up because of ASAS. We know that. But now with pre-implantation genetic diagnosis, that isn't the case anymore. So the couple can live a happy life together. And every young lady out there who wants to get married to her heartthrob can also get married to, even if it's ASAS. Any couple can get married and they can still have the desired sickle cell free baby with pre-implantation genetic diagnosis. So you see, the advantage is enormous. It's enormous, and it's a very beautiful thing, and it has helped a lot of families. And I want to call out to all our viewers out there who have been facing the challenge of probably having the desired sex of a child, or having to struggle with the fact that your spouse is AS and you are AS. It's no longer a problem. Just come forward, and with pre-implantation genetic diagnosis, we're going to take care of that and ensure that you have your desired sickle cell free baby or the desired sex you want. So the advantages are enormous, and I want to say, please take your chance while the science and technology has brought this to our doorstep.
It's Health Monitor, the #1 health show.
What can cabbage do for you? Cabbage is rich in antioxidants and phytonutrients, which are linked to heart health. It is a good source of fiber, which promotes gastrointestinal health. Abundance in vitamin C, which supports a healthy immune system. Renowned for its cancer-fighting properties, it helps to reduce the risks of prostate, breast, and other cancers. When choosing between red or white cabbage, go for the red. It contains more protective phytonutrients than white cabbages.
It's Health Monitor, the #1 health show.
Welcome viewers. Today we want to talk about care of our eyes. How do we take care of our eyes? When I got to the studio, I was asked a question. I was asked about optometrists, optician, ophthalmologists. The three of them, they have something in common. They are all part of eye care team. These three people and others like nurses are supposed to work together to support the patient, to make sure the patient is seeing better. Each person has a role. The role of optician is to fix glasses, is to fix lens. While the optometrists are professionals who can do tests for glasses, they can do simple eye tests, and they can also treat simple eye conditions. While the ophthalmologists are medical doctors who specialize in management of eye diseases. So they make use of drugs, surgery, and lasers where necessary. Now, to go to the real matter, the eye. The main function of the eye is to see. Apart from the beauty, it adds beauty to our face. But the most important function of the eye is for us to see. So what are the things that can prevent the eye from seeing? We want to look at three of them. One is cataract. Now, the image in my eye, the eye model, this part that I'm holding is the lens. The design from God is that it should be transparent so that light can pass through the lens and fall on the retina. From the retina is transmitted to the brain through the optic nerve, and the brain now gives interpretation of the image in front of me. If there is a disturbance in this pathway, the vision will be affected. So if the lens is not clear, if it becomes cloudy, then there will be a disturbance. So that is what we call cataract. It's a common eye condition. In fact, it's the #1 cause of loss of vision. It causes reversible blindness, but it's very common and it affects all age groups, though more common in the elderly. So what are the features that we may experience if we have cataract? Image becomes blurry. For those who drive, there is scattering of light, or when you look at light at night, it becomes scattered. So those are some of the features you can have when you have cataract. Then as it progresses, the blurry of vision gets worse till one gets to a stage that you can't see anything again. So that is cataract. It happens gradually and it gets worsens over time. So for cataract, the simple treatment is to remove the old lens that has become cloudy and replace it with a new one, artificial one that will do the same function. Now, if we leave cataract alone, there is what we call glaucoma. Glaucoma is the #1 cause of irreversible blindness. Cataract is more common, but cataract is reversible, while glaucoma is not reversible. So glaucoma is a disease of optic nerve. I said anything you see get to the retina, and through the optic nerve is transmitted to the brain. Now, we have neurons on the retina, about 1.2 million of them. So in glaucoma, we have gradual disruption of these neurons. We have gradual loss. So finally, it leads to damage to the optic nerve head. And at that point, whatever the eye sees cannot get to the brain. What causes the damage? One is the eye pressure. The pressure builds up in the eye. As we measure blood pressure, we also measure eye pressure. And it's expected to be in the range of 10 to 21. So when it's above that level, it can cause damage to the neurons inside the eye. When damage occurs, these neurons will not be able to perform their functions. So that is the common event in glaucoma. Even though we have what we call normal tension glaucoma, the people that their pressure is in the range of 10 to 21, yet they are losing their neurons. What that means is that they are becoming too sensitive, and that level is also high for them. We need to lower the pressure further. So what are the features of glaucoma? In majority of patients, it doesn't have a feature. Patient does not know something is happening. And when they know, it is rather late before they know something has gone wrong. Except in the acute angle closure glaucoma, which usually happens suddenly. Patient may present with severe pain, headache, or when they look at light, they see rainbow around light. So that happens in minority of people. We should not wait for that, because in about 2/3 of glaucoma patients, there are no symptoms. By the time they have symptoms, they've lost significant number of neurons. So what do we need to do to prevent glaucoma? Regular eye check. We should not wait till we have symptoms. We should not wait till we have any complaint. We should make it an habit that we should check our eye at least once a year. For those who have family history, they should not wait. They should check their eye immediately. And if doctors find something that you have glaucoma, there are tests that we do to confirm. If that is confirmed, doctor will place us on a schedule, on a regular visit, and determine the appropriate management for glaucoma. But for people who don't have any symptoms, we should check our eye immediately and make it a habit to check every 2 years. Let me talk briefly about how do we manage glaucoma. We can use drugs, we can use surgery, we can use lasers. And all of the three may be used in one patient when necessary. So the key thing is, let's make sure we check our eyes. Let's make sure if we have glaucoma, we use our medication. This is the only way to prevent visual loss to glaucoma. So if the glaucoma is diagnosed early, we can preserve our vision. So that's why we can never overemphasize the need for regular eye check. The third one I want to look at is a condition called macular degeneration. So when you look at the picture in my eye, at the back here is what we call macula. Macula is the most sensitive part of the eye. It's the one we use for finest vision. So when you have any problem here, then the vision will be affected. So macular degeneration is a special condition, more common in people above 50, and we have gradual damage to the nerve cell that we call photoreceptors at the macula. That's the most sensitive part of the eye. So for what are the signs that one may see? For those who are vigilant, when you look at lines, it becomes distorted. Straight line becomes wavy. When we notice that, then we need to take a further step to find out why. And it's good to cover each eye to know which eye has a problem. Is it the two? Is it the one? To understand what we're talking about. What are the prevention? It's difficult to prevent, but simple things. Smoking has been implicated. We should stay away from smoking. Vegetable is good for the whole body, especially for the eye. Vegetable, fruits, all that will help us to preserve our vision. Now, we started with cataract, which I show you the lens. The function of the lens is to focus light on the retina. If the lens is not transparent, the light will not pass through. And if it passes through, it scatters. So that is one of the reasons why some patients will complain of scattering of light. Again, I said cataract, even though it's the commonest cause of loss of vision, the treatment is extraction. It has to be removed and replaced with another one, artificial lens, which can be there for life and perform similar function. We also talk about glaucoma, which is neuropathy. It's a disease of the optic nerve and is the commonest cause of irreversible loss of vision. The most important thing we can do to prevent visual loss to glaucoma is to check our eye regularly. Let's check our pressure. Let them take the image of our eye, which we can follow regularly to know the pattern. Whether the cup, when I say cup, I'm referring to the optic nerve, the center. If the cup is stable or there is gradual enlargement. The gradual enlargement means we are losing neurons. I said earlier there are 1.2 neurons in the eye that form the optic nerve, and in the glaucoma they are lost gradually. They are lost gradually till you get to a point that the patient cannot see again. And initially everything is still okay. Patient does not even know that something is going wrong. For glaucoma, we don't need to wait for symptoms. The last one is the macular degeneration. And the most important thing about macular degeneration is to consume vegetable, fruit, stay away from smoking.
The number one health show.
Banana. These sweet delights have more potassium than most fruit and may help lower blood pressure levels. Did you know people with rubber latex allergies may also be allergic to bananas, since the two come from similar trees and share a common protein?
It's all about care and hygiene and protection all the way. Real mothers know this, so I stay good every day.
You're welcome once again to Mother's World on Help Monitor Your Guide's Good Health. Today I want to look at why babies need twice as much sleep as adults. The amount of sleep a baby has will affect his moods, alertness, and ability to concentrate and participate in his environment. Excellent sleep is just as important for your baby as the nourishment he gets. Researchers highlighted the importance of sleep in the development of a baby's central nervous system, and also indicates that a healthy immune system is in part dependent on a baby having a sufficient and quality sleep. The only way for your baby to completely switch off and recharge is to sleep, as this state offers him or her sanctuary from his physical and social environment, given that he or she has not learned how to block out sounds and movements he does not need. So while awake, every sound and motion becomes a new experience, which requires physical and mental energy to process. When babies are asleep, we tend to presume they are in a simple state of rest. In fact, babies have two preset sleep cycles: deep sleep and active sleep. These rotate in cycles of around 60 minutes during your baby's sleep periods. This is quite different from adults' sleeping pattern. During active sleep or rapid eye movement sleep, you may see your babies twitch, smile, or flutter their eyes open. This is because there is a large amount of activity going on within the brain. Although he or she looks peaceful and relaxed, but his mind is very alert. During deep sleep, one is not totally sure of what is going on in your baby's brain. This period makes connection deep with the brain. Some experts suggest this when deeper section of brain continues to develop.
It's all about care and hygiene and protection all the way. Real mothers know this, so I stay good every day. It's her monitor, the number one health show.
Now we have come to the end of the program. I hope you have learned one or two things. Till I come your way next time, I am Adenike Famujuro Fakayode. Stay healthy and be healthy.